Hello, everyone. I know that there are many teams across AHS who continue to work very hard to support each other and protect the health of Albertans. We featured some of these teams on the blog, and today I'd like to shine a spotlight on our colleagues in environmental public health. During the COVID-19 pandemic, their work has grown exponentially, and the role they play is vast and vital. They are a primary source of public health information for Albertans, creating and updating resources for the home, businesses, and communities, which we post on our environmental public health website. They've taken on a number of important responsibilities during this pandemic and are committed to working with businesses and communities to provide further clarity on how to operate safely during COVID-19. This includes advising on food safety, daycare, personal services, and more, outlining possible health risks that may arise and the risk of COVID-19 exposure or transmission. This job isn't easy. We know the current COVID-19 restrictions are difficult for many, and this is a stressful time, mentally, emotionally, and financially. Sometimes this leads to high emotions. Joining me to talk more about the great work environmental public health is doing and the challenges they face are Dr. Kathryn Koliaska, Medical Officer of Health for the North Zone and Safe Healthy Environments, and Mark Fehr, Executive Director, Safe Healthy Environments. So welcome to you both. Kathryn, I'm going to start with you. Can you highlight some of the great work that environmental public health has been doing and how the pandemic has changed the important work that they do?
Public health inspectors work to support communities to promote health and prevent and protect from injury and illness in this public spaces we live, work, and play in. Oftentimes, people think of public health inspectors as the restaurant inspector, but in reality, they do so much more. They work with operators of businesses and facilities to provide education to help keep people healthy. For example, schools, daycares, rental housing, congregate living, recreational areas, salons and spas, and more. With the new demands of the pandemic, public health inspectors use their public facility inspection expertise to support outbreak preparedness and prevention by both phone and on-site consultation for congregate settings. Our team has responsibility for inspections of approximately 1,500 congregate living facilities across the province. We've partnered with Seniors Health, Infection Prevention and Control, and the provincial audit team to do rapid audit inspections in seniors facilities to help protect residents. Public health inspectors have historically managed gastrointestinal outbreaks in facilities, but with the stricter outbreak definitions in the pandemic, inspectors work in partnership with communicable disease control nursing and medical officers of health and have expanded their role to do all preliminary outbreak investigations of all types and support in all congregate facilities and manage all but the COVID ones right to their conclusions. We work in partnership with communicable disease nursing to hand over the ones that are COVID once they're identified as such. Since the pandemic began, public health inspectors have often been the first point of contact for any complaints or questions about COVID and the CMOH orders for the entire province. To date, our team has addressed over 55,000 complaints and questions. Wow, team. Part of this complaint question service includes dealing with the public, either over the phone or on-site at a facility or location. In addition to the Public Health Act, public health inspectors ensure that the CMOH orders are understood and followed. Occasionally, when there's a persistent threat to public health, and after providing information multiple times, the public health inspector has the ability to do enforcement via executive orders, which can lead to a court appearance and possibly hefty fines.
Do we know how many complaints we generally get, let's say, in a typical year that's non-pandemic?
Safe Healthy Environments typically receives approximately 200 complaints per week. This is much lower than what we're receiving now. Right now, through the pandemic, we're receiving anywhere between 800 to 1,200 complaints per week, and in some weeks as high as 2,000. So comparing to normal operation, it can be as much as 10 times higher.
And staying with you, we want to kind of know a bit more about how public health inspectors work with the police as well as with the municipal enforcement partners.
Public health inspectors, when they review a file, they might determine that there's an unacceptable danger. So they would consult with their manager and they think that the best course of action would be to bring the police with them to go out to do an inspection. And the role of the police is to ensure that things don't get out of hand, that they ensure the peace and protect the public health inspector. When the public health inspector and the police go together, public health inspectors primarily use education, and even when the police are with them, they've continued to use education. So they're using education, warnings, trying to encourage compliance. And on a first visit with the police, it might just end with, there's a warning and encouragement to comply with the CMOH orders to protect public health. And only in some exceptional circumstances would the inspector go back out with the police. And the role of the inspector would be to advise the police on whether they should be issuing a ticket. And that would be when they're out there jointly. There are other examples where the public health inspector can provide information to the police and the police can go out independently to issue tickets. And the police aren't the only partners that the public health inspectors work with. The inspectors have strong working relationships with municipalities and other enforcement partners, and they're relying on existing working relationships to encourage compliance with the CMOH orders.
Kathryn, coming back to you, what are some of the challenges that the team has been facing?
We have a small but mighty team of approximately 270 public health inspectors who live and work in communities across Alberta and who provide a valuable resource to our communities. Recently, though, as COVID fatigue has been setting in, they have unfortunately also been targets of harassment, threats, and blame as they go about their work. There have been 45 CMOH orders so far, and likely more to come, through the business restrictions, questions, masking in indoor public spaces, changing rules, and angry people. They've been extremely adaptable and professional through the ever-changing demands of the pandemic.
Thanks, Kathryn. I can't imagine the stress that the EPH team is going through. So, Mark, how is the team doing? Because obviously these must be really difficult times.
We recently surveyed our staff, and even though it's extremely busy, we got a response rate of around 60%. So around 180 people within Safe Healthy Environments replied back. And what we found, a prominent theme, our team is feeling overwhelmed. They've got a daunting workload. And during the pandemic, it's day after day pressing demands. This is different from normal operations. During normal operations, the inspectors are feeling that people are welcoming to them, that when they go out to provide education, work with operators or the public, people are glad to see them because they're perceived as being helpful. But during COVID times, it's a lot different. It's a continual expectation of enforcement and ensuring that compliance with changing CMOH orders. Something else that the staff reported back to us was a feeling of support, that they feel supported by their colleagues and their managers, and that there's a sense of going through the pandemic together. Other challenges that they've got is that the choices of what people are doing during the day, it's more limited. In normal operations, the inspectors can basically choose what they're doing, set their priorities. And during the pandemic, it's as though their priorities are set for them. Every day, it's follow up on COVID complaints. And the challenge with following up on COVID complaints is we've got a delicate balancing act. When we go out and do enforcement, we get complaints that we're doing too much, that we're enforcing too many rules, unnecessary rules that need to be put in place. So people thinking that we don't need to do this. On the flip side, we've got other complainants that are thinking we're not doing enough. We need to take more action, do more enforcement. We're also getting feedback either from operators or from the public. And some of that feedback we're getting is extremely unkind. It can be threatening and harmful and cause stress to our team.
Yeah, thanks, Mark. These are really hard things for me personally to hear. Kind of caught between the rock and the hard place. And I would say that the team has just been under relentless pressures. And obviously that builds up over time, and it's very hard to sustain. So, Kathryn, coming to you then, what can we do? What can all of us do, everybody in our organization, to support everyone in environmental public health and each other?
I think it's important to recognize that we're all personally and professionally tired from fighting the COVID pandemic. We've been at it for almost a year now. A supportive and friendly comment from a colleague goes a long way, I think, towards getting through the day. Not complaining or unloading on someone, and perhaps most importantly, sticking up for each other if we see someone being disrespected or worse. We're an amazing team in AHS, and our strength really is together.
Thanks very much, Kathryn and Mark, for coming on to the blog today. Please give my best to everybody. The environmental public health team, along with many others all over Alberta, is doing truly exceptional work in the face of so many challenges. And what you've described is something that we can all empathize with. And as you've said, Kathryn, during stressful times like these, kindness is more important than ever. And I've always said there is no cost to kindness. That's why we've launched a public kindness campaign, reminding Albertans that AHS is here for them, but harassment of our staff is never okay and will not be accepted. We're spreading the word through our social media channels and asking our partners, including our health advisory councils, provincial advisory councils, and health foundations, to remind people in their communities to treat our public health inspectors and all of our staff with respect as they go about their important work. I also encourage you to reach out to your colleagues with an encouraging note, call, or e-card to let them know you're thinking about them and are there to provide support. A simple touch base can go a long way to brightening someone's day, and we have many resources and supports in place to help you if you are feeling overwhelmed. You can visit our Employee and Family Assistance Program page on Insight for additional resources and contact numbers to help access needed support, or you can call the program directly at 1-877-273-3134, which is available 24/7. I encourage you to use these resources and continue to support one another. And myself and ELT, we will continue to do our best to support all of you. Thank you so much for watching, and I'll see you again next week.
Together, we do amazing things every day.